But first, let me go to the coronavirus outbreak to look at the risks both here and overseas. I'll start with the New South Wales Health Minister, Brad Hazzard, who I caught up with just a few minutes ago. Minister, thanks for joining us. The last figures I've seen is that there are 4 confirmed coronavirus cases in New South Wales. Can you tell us the status of those patients and how many other patients there could be fears about when it comes to this virus?
Each of those patients have now been placed into a major hospital here in Sydney, and they're all doing well, quite stable. As at yesterday, of course, we had 3 in New South Wales and 1 in Victoria, which was a total of 4 patients. And of course, today, one that we announced yesterday was a possibility, has been confirmed today here in New South Wales.
Indeed, so we still have that other case in Victoria. What efforts are being taken at the moment to visit, to test, to consult with the people that those cases, those patients will have been in contact with over recent times?
There's a lot of work going on between each state and territory with the federal government. Obviously, at the moment, the focus is on both Victoria and New South Wales. I've personally had discussions with the Federal Health Minister, Greg Hunt. Today at 2 o'clock, there was a major conference call between each of the health ministers plus other significant health staff discussing protocols and how best to deal with it. It is very much an evolving situation. The latest, the first patient, of course, the first person who had the coronavirus in New South Wales came into Sydney on the 6th of January. And the latest one who has announced to the 21-year-old girl came in on the 24th of January. So there has been a period where, obviously, from China and from Hebei province, there was a lack of clarity. And I have to say, there remains a lack of clarity, but I'm very, very happy with the way the New South Wales health authorities and the federal health authorities are dealing with the matter at this time.
I think that's important for public reassurance that you and the other state health ministers, state health authorities and the federal government are working cooperatively. You would have been well rehearsed in planning for this sort of eventuality you've had to deal with in the recent past, the SARS epidemic, for instance. Presumably there's a lot of focus on travel into and out of Australia from particular areas. Can you tell us any more about that? Obviously, Wuhan province has been a focus, but is there any additional checking on general travel from China?
Wuhan City is definitely the centre of action at the moment, and Hebei province is also now broader. Wuhan is a city in Hebei. So, but we're looking and keeping very close track of what's happening in terms of the other Chinese flights coming into Australia. Can I say it is important? I mean, each of the people who have actually been diagnosed so far have come to Australia and have actually presented themselves either to a GP or to an emergency department. That's fantastic. That means they're hearing our message and understanding that in our country we're very supportive of people with health issues. Their privacy will be absolutely protected. They need not fear, and in fact, if they come into any of our emergency departments in New South Wales, they will be treated free. Normally a foreign visitor, unless they have travel insurance, of course, but they would be paying their costs if they came to one of our hospitals. That's not the case. So it's certainly, in this particular case, the government, the New South Wales government, is making sure that visitors, our friends from China, understand that we will make sure you're well looked after and very well cared for. And that's happening in one of our major Sydney hospitals at the present time.
Well, it's good to hear that the condition of the patients in Australia thus far doesn't sound like they're gravely ill. But one of the other concerns with this particular virus is it seems from the information we're getting that the initial symptoms, at least, are not particularly alarming at all.
Well, I think the challenge for public health authorities particularly is that the symptoms, there's no indication you've actually got the virus until the symptoms become apparent. Now, the symptoms, of course, are very similar to flu. You can have a runny nose, sore throat, a fever, a cough. And so if you have got any of those symptoms, I just say this to anybody who's been in China broadly, but certainly in Hebei province or Wuhan, if you do have any of those symptoms and you have been to Wuhan or you've been in contact with somebody who is known to actually have the virus from Wuhan, we would strongly ask you, implore you, to contact health authorities here in New South Wales and indeed Australia. And the way to do that is to make sure that if you are going to go to your GP or a GP, you ring ahead, let the GP clinic or GP practice know that you're coming to make sure that everything is done in an appropriate way. If you're going to a hospital emergency department, the same thing. If you could ring ahead and just let the hospital know that you have a suspicion that, you know, having come from Wuhan or been near someone who's got the virus, that you're going to come into one of our hospitals, that would be really helpful. If you want a general chat about the possibility of what you might have, then in New South Wales you can ring 1800 222 022. I'll just repeat that, 1800 222 022. That's our health direct line. And if you do need to have, or it's a friend of yours that needs to have translation done because of perhaps speaking in Mandarin, we can also organise that as well.
Just finally, Minister, I'm aware of at least one school Chinese New Year event that was cancelled because of concerns over the coronavirus. Are you worried that there could be an overreaction in the community, or are these community organisations in touch with health authorities and getting the best advice available?
I think there are some challenges which New South Wales Health is trying to address. We have a press conference very shortly with Chinese media here in New South Wales, and that'll be exclusively for Chinese media. We've done one this afternoon for major media, but again now it'll be Chinese media, because obviously we need to make sure that we're reaching out in every manner, shape or form. We're looking at every opportunity through social media as well. Can I say this? If a child does not have symptoms, or if a child has not had any contact with anybody from Wuhan, then I have to say to you that we'd be more than confident about the child going to school. In fact, that would be the best outcome. But obviously each family has to weigh those issues up, but I think it would be helpful if they listen to the formal information rather than perhaps the information that's just below the surface amongst some of the members in the community, because that could get it wrong. Yesterday, New South Wales Health also put out a lot of information, and it's on their website, in Mandarin. So I would encourage folks who might still be struggling with English to have a look at the Mandarin website. We are there for all of our citizens. Our government here in New South Wales, all governments in Australia, understand we have a wonderful multicultural society, but we need to make sure the messages are heard.
Thanks for joining us on a busy day, Minister. I appreciate it. We'll keep in touch.
It's a pleasure, Chris. Thank you very much.
Let's get some medical expertise on this issue now, and I'm joined by Dr Peter Collignon, who's a professor at the Australian National University in Canberra. He joins me live from Canberra. He's an infectious diseases physician and microbiologist. Thanks for joining us, Doctor. I wonder if you could firstly tell us what level of concern you would draw from the early information about the coronavirus.
Well, my concern is a bit stronger this week than it was last week. Last week there seemed to be mainly evidence that it was animal to people and relatively not as much people to people exchange of the virus. But now it appears most of the transmission is person to person, and there's a lot more cases than we would have thought were likely a week ago. So my concern level is up compared to a week ago. It's quite widespread through many areas of China. It still has this concentration in Wuhan, but also there's now quite a number of cases that have been found in many other countries around the world, including Australia, limited numbers. So I guess the good news also is that at least from people that have been overseas and been diagnosed there, their cases have been relatively mild. We haven't had people with severe infection, in contrast to SARS, which was around more than 10 years ago, where the majority of cases were very sick and often in intensive care. So the good news is that this is less severe than SARS, at least initially on the data we've got available now. The bad news is it appears to be much more transmissible from person to person than we thought a week ago, and probably more, maybe more than SARS was as well.
And also, I'd just like to get your thoughts, Doctor, on the fact that the symptoms appear to be relatively mild, that it seems you can have the virus for quite a while before the symptoms become evident. Therefore, hundreds of thousands of people, if not millions, have been travelling in and out of Wuhan before they've effectively closed off that city. And so the spread of this contagion could have been quite dramatic, not only throughout China but the world.
Well, that is a concern. The average incubation period, in other words, from when you were exposed to the virus to when you get sick or any symptoms, seems to be around 5 days. And some people get as sick as 2 days afterwards and some as long as 11 days afterwards. So that's the sort of period where after exposure you then might develop symptoms, and if you send it to anybody else or give it to anybody else, you are likely to have symptoms yourself, which actually means you'll have a cough, a sore throat, running nose, etc. But that's the problem, is it's winter over in the Northern Hemisphere and in China. So there'll be a lot of people with influenza, the common cold virus, other coronaviruses, for instance, that may cause those symptoms. And our problem then is, well, if you've got these symptoms, how do you tell whether it's this one or one of the others? And also with time, we need to work out, well, while the death rate looks relatively high, well, it's a few percent, which is relatively high, it may be that we're overestimating the death rate because there's a lot of people with really mild infection we haven't found, and we'll only find that in retrospect when we look for antibodies to the virus in them. So there's a lot of unknowns, but there's a lot of problems with the vast majority of people who come here from that area who have respiratory symptoms will not have this virus. They'll have something much more common.
Tell us, if you can, just about the genesis of a virus like this. My understanding is it's not uncommon that, of course, viruses are always evolving or mutating and constantly throwing up new varieties, and so this process of being vigilant for new viruses is constant and ongoing.
Well, the problem is, for this one, we don't know yet, but the last examples of this type of virus, coronavirus, is the SARS virus, and then also something called the Middle East Respiratory Syndrome virus. Now, the SARS virus appears to have come from bats to civet cats that then got into people and got people-to-people transmission. The Middle East Respiratory virus came from camels that went to people, and then some people-to-people transmission. Now, this one we don't know. There appears to have been some contact in a market in Wuhan originally, and so maybe it came from an animal to people. But there's also some cases that were earlier than that that did not appear to have contact with those markets. So we really don't know, but what's beyond doubt now, there's human-to-human transmission, which is a little bit unusual for viruses initially coming from animals because they're usually a bit harder to transmit from person to person. So that makes this one a little bit difficult and different. But you might remember the flu virus when we get a new strain. For instance, the swine flu virus that was 2009, that initially looked to have a high mortality when it was first found in Mexico, 7-8%. But that's only because the really sick people were the only ones that came to hospital and were diagnosed. And when it was in California, the death rate was about 1 in 10,000 instead of, 3 in 100 or more. So this may well end up being the same, although again, the bad news of that is there may be a lot more transmission in the community than we've diagnosed so far, and that means it'll be harder to stop it transmitting to other people, which unfortunately at the moment is the only thing we've got up our sleeve to try and stop this. We don't have any drugs for this, we don't have any vaccines, and they won't be available for quite a while. It may be, like a lot of cases of influenza, what you die of is secondary bacterial infections that get into your lung and cause pneumonia, and we've got antibiotics for those. But for the actual virus itself, what we need to do is stop the transmission, and that means keeping people who are sick away from people who aren't, and doing things like hand hygiene with alcohol hand wash, because that makes a lot of difference for all respiratory viruses, because often we touch our nose, touch our eyes, touch our mouth, and if we disinfect our hands with alcohol hand hygiene products, that stops that. Some people can wear masks, because that again maybe stops you breathing it in, but probably more importantly stops you touching your own nails and mouth. And basically, if you're sick, keep away from other people until you're better.
And that's your advice to people in Australia here and now? You would be suggesting that we should be even more conscious of normal day-to-day hygiene than normally?
Yeah, that should be our practice all the time. If you're sick, don't go to work, don't go by public transport, keep, at home, almost in a self-quarantine. That's what we should recommend. It's what we recommend for influenza. It's what we recommend for all respiratory viruses, even the common cold. This, we don't know how bad it might be, both in spread and its severity. I think probably not as bad as we originally looked for the death rate, but we do need to be vigilant because we don't know, we need more information. And prudence says, look, take more precautions than normal because this is a lot of unknown, and basic things like hand washing, hand hygiene, mask if necessary, but particularly keeping away from other people if you've got a cold or a sniffle, and particularly if you may have had any contact with anybody that has been to any of these areas of China or China yourself. You need to keep away from other people till we know what you've got. And even if you've got something else, it's better for everybody else if you don't give it to them anyway.
Just finally and briefly, if I could, Dr. Peter Collignon, I'm interested, obviously our medical advances in dealing with the risk of epidemics has developed exponentially over the past century or so. But of course, with the growth in population in this country, on this planet, the population density in a country like China, and the extent to which we travel vast distances quickly, it must make it increasingly difficult to contain something like this.
Well, it is increasingly difficult because we have, literally, I think, a couple of billion people who travel by plane every year. And so what used to be much more effective with quarantine because it was in boats and, a lot of Australia had quarantine stations, that is much less effective because the big advantage we had in Australia, it took you 6 weeks to get here. So you well and truly were sick before you got here and we knew about it. But now you can get on a plane, be here 8, 10, 12 hours, and if the incubation period is up to 11 days, you won't get sick till you're back. And you then, have almost a complacency, oh, it must be something else. So, yes, it is much harder. We've got better diagnostic facilities now, so we can tell what you've got much quicker rather than just relying on our hunches, if you like, or our diagnostic ability. But equally, we've got people that can, travel much more frequently. And we're much more, there's a thing called One Health, where the environment and animals interact with us. This is probably another example of that. Here is a virus that was in the animal world, through the environment somehow, water or direct contact, got to people, it adapted to people and then was able to spread directly to person. So that's occurring more and more. SARS is another example, and we need to be vigilant of that. But what we really need to do is stop the transmission as much as we can, and that is often basic things: hand hygiene, alcohol, hand washing, wear masks, but keep your distance from people if you're sick. Keep at least 1 metre away, and preferably stay in your own house and don't go near other people at all.
Peter, thanks so much.
Thank you.